Hello, everyone. Thanks so much for joining us tonight. We're gonna wait maybe a couple of seconds for folks to start joining us to the room. Thank you for waiting. Thank you so much for joining us. Couple more seconds. All right. We have a good number flowing in. We're going to go ahead and get started with tonight's program. Hello, everyone. Thank you so much for joining us tonight. This is the second session of 3 of the Journey to Medicine Insights and Stories from 3 medical students living with Tourette Syndrome. My name is Dao Duong, and I am the Senior Manager of Community Programs here at the Tourette Association of America. My colleague Alexandra Walsh is also here, Manager of Programs, to support tonight in the chat and the Q&A later. Tonight's event is being provided as part of the Tourette Health and Education Program in partnership with the CDC. The views expressed by speakers and moderators tonight do not necessarily reflect the official policies of the Department of Health and Human Services, nor does the mention of trade names, commercial practices, or organizations imply endorsement by the U.S. government. After the presentation, we will be asking attendees tonight to partake in a brief survey to let us know what you thought of tonight's part 2 of a 3-part series. Tonight's session is made possible by support from the CDC. So not only is your feedback super important to us, but it also shows the CDC the value of programming like tonight and hearing the stories of these wonderful speakers. Okay. For those of you that haven't gotten to hear our speakers or know our speakers from our first session, first up, we have Michael Chioco, a Filipino-American diagnosed with Tourette syndrome, and is currently a first-year medical student at the University of California, San Francisco. Michael graduated from Northeastern University with a BS in biochemistry and a minor in psychology. Michael first showed symptoms of Tourette syndrome when he was 5 years old, and then he got diagnosed at the age of 14. He's been involved with the TAA for many years as a youth ambassador and a rising leader. He's a passionate advocate for Tourette syndrome and has presented at numerous venues such as KQD Radio, TEDx, various elementary, middle schools, and universities across the country. As a future medical physician, he is interested in exploring the fields of neurology and pediatrics, and also hopes to dedicate his career towards addressing health disparities for individuals with TS and disabilities. Through his career and through public speaking and advocacy work, he strives to encourage individuals with TS and disabilities to embrace their differences and see them as a strength. Next up, we have Jeremy Rosenbaum, a second-year medical student with Tourette syndrome at the Keck School of Medicine of USC. Prior to attending medical school, he graduated cum laude from California State University, Chico, with a BS in exercise physiology and a minor in chemistry. As a member of Chico's honors program, Jeremy conducted research investigating the influence and mechanisms of Tourette comorbidities on severe bouts of tics. He presented this research at TICCON 2023, actually. Jeremy aspires to become a cardiothoracic surgeon and is currently engaged in research investigating the impact of psychiatric comorbidities on the treatment and health outcomes for people undergoing surgery for thoracic malignancies. Kevin Liu is a second-year medical student with Tourette syndrome at the Keck School of Medicine of USC as well. As a first-generation Asian American growing up in rural-esque upstate New York, he has had unique experiences adapting to the challenges posed by Tourette, while simultaneously navigating hostile environments created by prevalent interpersonal racism. Kevin graduated summa cum laude from University of Southern California with a BS in biochemistry and a BA in philosophy, and he is currently pursuing his MD from the Keck School of Medicine at USC. Kevin aspires to become a neurosurgeon and is currently conducting clinical research on neurosurgical techniques used to treat psychological disorders such as depression and OCD. And with that, we have our wonderful 3 presenters for tonight. I'm going to go ahead and kick it out to Michael, and you can go ahead and start the show whenever you're ready.
Great. Thanks so much. Well, hello, everyone. Thanks for coming out. Again, great to see you all for those that were able to join us last one. And if this is your first time attending, welcome. Yeah, so the 3 of us just want to make the focus today to be sharing kind of our insights and stories of being in medical school with Tourette's. We'll talk about, navigating classroom at work and kind of long hours and accommodations. We'll talk about navigating tics and Tourette's in the clinical setting, whether that be in the operating room, talking to patients in clinic. And we'll also discuss how kind of our experiences intersect and influence what we want to pursue as a career professionally within medicine. Yeah, and we'll have some time at the end for discussion, reflection, and questions as well. And I will kick it off with hand it off to Kevin.
Thank you, Michael. This is going to be a fun one. So first, I wanted to talk a little bit about navigating tics in our preclinical or classroom setting. So before we get into the hospital and actually see clinical things, when we're still having lectures and listening to people talk at us and trying to learn medicine while sitting down. So one of the things that I know you, Jeremy, know a lot about me is I have my corner in the lecture hall. So in the huge lecture hall where we have lectures, I always take a little corner in the front left side in the third row from the front. Variable seating in that area. But the reason for that is when I would sit with other people, they would be distracted by when I would tic, like when I would clear my throat. And I would be distracted then when I would notice them being distracted. We would kind of like make eye contact sometimes and no one would talk about it. But one of the things that I remember doing was kind of thinking, what's the best way that we can do this without, well, like, well, being able to benefit everyone? And so I decided to, I think it was like the first week of school, decided to mosey my way up into my corner that was in the front of the room, no one in front of me, not a lot of people near me. But my reasoning for that was that not only did it allow other people to focus better, which was one of my worries, it also allowed me to focus better too, because I wasn't next to other people. The computers are distracting sometimes. There's people playing 2048 or Amazon shopping or studying too, I find. But ever since that first week, I've been the king of that corner, as you might know. And it's worked really well. So in between classes, I would just go socialize with people, and then during class, I would go back. And the point of that, why I'm telling that story, is there are strategies that we can do to benefit everyone without having to either sacrifice um, other people's like that, or ourselves either. And then something similar is with like anatomy labs and small groups. When I remember it was like the first month of anatomy lab where I I was throat clearing a lot. I was really nervous about seeing the cadavers for the first time. And a lot of my classmates were in my anatomy group were noticing. And the the really funny thing about Tourette's is that the more stress that we have, the worse the tics become. But then when I notice other people noticing my tics, I get more stressed and they become worse. And it's like a infinite positive feedback loop. And over time, I talk to a lot of people. I talk to therapists. I talk to my close friends. I talk to my instructors in school actually. And the one thing that I always got was to just embrace it and realize that, so what if I'm ticking? And afterwards, I tried really, really hard to just embrace it and just be like, that's who I am. And it's really interesting because afterwards, I stopped noticing other people noticing me. And I don't know if that's because I was just more confident or other people realized that I wasn't making a big deal of it and I wasn't paying too much attention to it and they actually stopped noticing it. But overall, I think it actually decreased my stress a lot and actually made me more effective at doing what I need to do in lab. So honestly, what I learned is that as long as it doesn't affect what you need to do and you're able to finish your task, if you embrace it, it allows you to feel better. It allows the entire situation to go by more smoothly too. Um, Next point I wanted to mention, navigating fatigue, a lot of the stress with med school, similar idea. But one of the things that I noticed too was that when I have a lack of sleep, I would take more often. Um, and so just a simple adjustment that I forced myself to do was wake up at the same time every day, even on weekends, which I still think is terrible, but it works. So waking up at 8 a.m. or like 7:30 on weekdays and weekends and like having a normal sleep schedule, getting the things I need to get done during the day is really, really, really helpful in helping to manage my tics. Um, and with the stress of it, med school too, there's so many little things that we have to do. Like I know Jeremy, I don't know if you have to do it, Michael, but after every one of our classes, we have to do evaluations for our like lecture and like every class, and it's mandatory. And if we don't do it, they'll punish us. I don't know what the punishment is, but they will. And so I found like the first time I let it go until the end of our first class, it was like a ton of evaluations I needed to complete, and it was just a mountain over my head, and it added to the stress. And then I forced myself, though, in the future, just do them a little bit every day and just kind of chip away at that iceberg. And, just getting things done and staying on top of things also really help um, managing the stress and helping the tics too. So, and I think that applies to any setting, academic or work or just life in general too. Um, Testing accommodations, I didn't personally use any accommodations in medical school. I used to have accommodations when I was in up to middle school, but one of the moments that I guess I didn't realize I was embracing it at the time, but I actually stopped using accommodations towards the end of middle school, and I haven't used any since. And that's one of the actually a really proud point for me, being able to accept that if I can function and if I can do what I need to get done without using accommodations, then that's okay too. But I know Jeremy and Michael, you guys both have experience with this too. So I wanted to pass it off to you guys for this right now.
Sure, I could jump in here. I know that myself, Michael, Kevin, all three of us have had different experiences in terms of our use of accommodations. I know we briefly touched on this on the last one, but I thought that was an interesting takeaway. Myself, I've personally never had accommodations. I've always felt a lot of support from faculty, institution, people proactively, making resources available to me, telling me what accommodations were possible. But I felt fortunate that I never needed to. And I think, everyone has their own ways of handling this, and it's okay with everyone. But for me, something that what was really core to my building confidence in myself was not needing or not asking for pretty much just being in the same environment as everyone else. And I'll touch in on this a little bit more whenever we were talking about what we chose to pursue in terms of our interests within the field. And with all three of us, we're interested in some kind of procedural specialty. And for me to be able to go into that with confidence, I felt like it was helpful for me to decline the very valid offers of having these accommodations. Um, oh gosh, I have a number of fun stories I can share, but I'll pass it off to Michael and I'll tell some stories later.
Yeah, thanks. So, I think Jeremy and Kevin brought up really interesting points where accommodations, one, what accommodation you get or the need will vary from person to person, but it'll also vary in terms of kind of what you utilize. And a lot of that just kind of has to be done with what's available at the institution that you're at and what are you aware of. I was very lucky where when I was in high school, I actually had a teacher with Tourette's who really helped me out with kind of like, hey, this is what could be helpful. So I've been fortunate to actually have accommodation since high school, throughout college and med school so far. But a lot of that's very kind of dependent, situation to situation. And I think that's why we like having things like this to kind of say, hey, this is what is out there, because sometimes you don't know what's available. Some things, we mentioned this last time, but briefly, kind of the most helpful things for me is with testing. So I have my own private testing room and space for all kind of exams, and then time and a half extra time. Those are kind of the biggest things. Other accommodations that exist can be kind of preferential seating in the classroom. It can be kind of note-taking accommodations, deadline accommodations, um, extra break times, et cetera, et cetera, et cetera. Certain materials, if you need headphones, standing desks, et cetera. There's a lot of different things that you could do. But the point that I will make on accommodations is um, it requires, for better or for worse, I think it requires a lot of advocacy on your end, and to anybody that's listening that is kind of in our shoes of, being a student of any kind, whether it's medical student or not, no matter what level you're at, advocating for accommodations is difficult. So I kind of want to just kind of say that and empathize with you all, because it can be difficult to jump through a whole extra set of kind of like hoops and the application process and the writing and kind of every step of the way, like, oh, am I going to get approved for this accommodation or not? And you kind of feel like you're justifying your need for the accommodation when it feels silly to do so. So I just kind of wanted to say that that if there are any students in the audience, that we understand that it can be difficult to get that. Um, and yeah, we're here for you too, and know that you're not alone in that.
One thing that I just kind of feel like adding before we switch on, I know that, gosh, we had our second to last exam of our preclinical classes the other day. And I always, just like Kevin, whenever there's an exam, that's whenever I feel particularly self-conscious about trying not to have my, jaw ticks, my, odd movements with Tourette's be a distraction to others. Because if I feel like I'm distracting someone else, it'll distract me. So I always like to take my exams in the front, in the corner, where I'm kind of like away from, anyone else that might be distracting. But then also it decreases my own like internal stress of will there be any miscommunications? Like, will a proctor think that, me having these odd movements is like looking over somewhere else? So it was kind of nice. The other day, I look over to my left, I see Kevin right there, give him a wave right before the exam. Um, and I guess also another thing that I want to say is Kevin and I, we got to know each other pretty well during our first year. I know that having Tourette's, it's something that myself and I'm sure many others, panelists, everyone in the audience can empathize with, of being kind of like self-conscious of like, oh, I'm blinking, will I be judged for this? Or, how will it impact my function, how others think of me, et cetera. And I think that something that I had a very positive experience with, and I hope it was the same for Kevin. It was before last year's TitCon, whenever they were accepting applications for presentations. I I speak pretty openly about having Tourette's, but obviously it doesn't come up in every setting. But I noticed I saw Kevin, having like a few blinks or something throughout the year, and I was like, oh man, like I wonder, because I have not met many people in my life prior to them that have Tourette's. So I asked Kevin. I was sitting with him one day in one of our small groups, and after like towards the end of class, I was like, "Hey, Kevin, like, do you have a moment to stick around and chat?" He's like, "Sure." And I'm like, "Hey, I wasn't sure. I know for myself, I have Tourette's, and you might see me blinking a lot. Do you happen to also have Tourette's?" And then he's like, "Oh yeah, like I didn't even notice I was taking," and we just kind of like hit off, and kind of experience I've had has been very. It feels like you're kind of alone in it. It's amazing that Michael had a teacher that had Tourette's, I wasn't fortunate enough to have many people in my life that also had Tourette's or other similar movement disorders, and being able to find a way to kindly approach it and then find that nice connection was really valuable to me. I think I hope Kevin feels the same.
I do, and I didn't know other people with Tourette's existed until you came and like talked to me, and then now I'm here. So thank you for that.
Mutually beneficial. And I guess we could transition from here. Michael, if you want to take over again.
Yeah, sounds great. Thanks everyone. Yeah, so moving forward to navigating takes in the clinical setting, I will say this is my fault for submitting the wrong bio. That is a little outdated, but I am just for context because it might be helpful for this part. I'm in my third year of medical school at UCSF, and a few things specialty wise. I think I'm pretty interested now in anesthesiology, but still maybe interested in pediatrics. I wanted to give a quick overview on how med school works, kind of at a bird's eye view, just in case people are not familiar with how it is. We're saying preclinical, clinical, yada, yada, yada. In general, there's kind of a few phases. Preclinical is what it sounds like. So it's classroom. It can be anywhere from a year or two where you're learning about different diseases, pathology, kind of all the different things and what the diseases look like. What is the underlying science behind that? Usually around your second or third year, you transition to clinicals. And that's kind of where you spend, it depend on the school, but anywhere from 6 to 8 weeks, sometimes even shorter or longer, in different specialties. And the idea is to get exposure to varying types of medicine, both for your own kind of professional exploration on what do I want to do, and also to expose you to a wide kind of set of clinical kind of presentations. So that can be anything from neurology to surgery to OBGYN to pediatrics, psychiatry, et cetera, et cetera, et cetera. Um, and that's kind of the phase that I'm in right now. So, for most schools, it's about 12 months on rotations and clinical rotations, and I'm on month 11 out of month 12. So I think that's something that I wanted to talk about today. So a few things. I think kind of the first main point I wanted to talk about and story to share is approaching disclosure in the clinical setting. It's something, this is probably one of the things I'm asked about the most. Hey, Michael, like how do you navigate tics when you're talking to patients, families, other team members? And, even taking a step back from that, disclosure. Disclosure is a topic that, we've talked about a lot, like for anything. In the clinical setting, it's pretty unique because, when you're switching rotations every 6 weeks, I've had times where even within a rotation, I'm switching teams every other day. So, that can be up to 10, 15, 20 new people. When we're going to the bedside and interacting with the nurses who are taking care of our patients, they can switch frequently as well. So a lot of the times I've had to learn that there's going to be a lot of people, a majority of people that I work with, I just won't have an opportunity to disclose. And, or, I really have to make a dedicated time to disclose, knowing that, maybe um, I'm never going to work with them again. So it's like you put all this effort into a conversation or stress on yourself to disclose, and then, you're only there for 45 seconds of an interaction. And those are kind of things that I did not foresee as being difficult, of adding more cognitive load. So I think, going into clinical rotations, a big thing was how do I communicate this with teams? Do I want to send emails? Do I want to just kind of fill it out? And the way that I've kind of approached it in terms of the teams that I'm working with is it's a very kind of case by case basis. There was one rotation where I did upfront tell all of them that I had Tourette's, and I found that it didn't really change much. And I preferred to just kind of do it by feel. So show up to each rotation and kind of see how I'm feeling and kind of assess my needs based on my takes, how they were that day, and if I felt like there was a reason to do so. And that's kind of how I've navigated it. I think what's more interesting is, talking to patients and families. And, I was just talking to Jeremy about this, but I've talked about this with many different people. It's hard because a part of you, at the end of the day, our job is to be there for, the patients and whatever, and their families, whatever that may mean. And it can be hard to, even if it's, to help them feel more comfortable. Sometimes it's hard to talk about yourself a little bit with your tics and your Tourette's. And when, you really just, especially if they're dealing with a really acute health problem, it can be very difficult. And it's not as simple as like, oh, always disclose or always not disclose. So I will say this year, most of the time, I haven't actually um, had to kind of disclose to patients and families. And the way that I think of it is, a lot of the times especially, in inpatient settings, they have a lot going on. Most of the times they're not really paying attention to that. And again, this is where kind of bleeding into the last point of as we develop our own identity and style, I've found that sometimes it's hard for me to show from body language kind of engagement because maybe I'm taking or this or that. And what I found that's worked really well kind of in the clinical setting is I just try to be a little bit more verbal. I try to be a little bit more expressive of, if they are had a sudden hospitalization and it was just kind of out of nowhere and they weren't planning on this happening. This actually happened like last week. I will really address that and be like, hey, like I know that this is a lot. Like I hear you. This can be difficult when you had no idea this was going to happen. And I try in my own way, in my own identity, um, to show that I'm there for the patients. And that's kind of how I navigated it. And I haven't had an issue with my tics from that standpoint. I will say that we have these exams basically where you see a standardized patient. So what that means is an actor that is pretending to be a patient. And then we're videotaped, and then people are watching, like our school is watching us and giving us grades. That is the only time that I disclose Tourette's. I'm hoping this will change in the future, but when someone is watching you like that and they're grading you, the way that the grades work is they have a checklist of things that they're grading, right? Like, are they making eye contact? Are they, how is their body language? How are they positioned? And that is where, in my first year, I was very frustrated at that because I said, well, that's kind of unfair. And so I kind of, in those exam settings, I do disclose, just kind of as a way to just kind of clear the air in the beginning because I know that we're being graded in that sense. So I do kind of say a very quick, hey, we introduced myself and I said, hey, it's good to meet you. Before we get started, I tell this to all my patients, like I have Tourette syndrome. It's a neurological condition in which I have different movements called tics. You might see me maybe moving my eyes, blinking my eyes, making some sounds, making some movements, but I want to assure you that it's not going to impact my attention or focus and care to you. And if you have any questions about it, I'm always happy to chat more about it. And I kind of pause, let them respond naturally, and then I lead into, so what brings you in today? I've done it a few times with real patients, but more often than not, it's in the kind of observed clinical exam setting that I do that. Um, I want to now move on to kind of talking about being in the operating room since, I'm interested in anesthesia, and I know at our last session we were asked about this quite a bit as well. Yeah, it's going into med school, I thought I wanted to go into pediatrics, neurology, kind of be part of it because I was inspired by kind of, having Tourette's and growing up with that and wanting to go into neurology. But part of it, honestly, feeling because I didn't think I could do anything procedural or surgical or anything like that. I kind of just blocked it all out. And I remember in my second year of med school, one of my friends was like, Michael, like you really should just go shadow and like watch like an anesthesiologist because we really think, you'd like it. And it wasn't something that was even on my radar because I kind of just said, hey, if this field has something procedural in it, I'm not going to do it because I'm scared about what reaction or stigma there may be there. I ended up really loving it, and it was for a while I was kind of in denial about it because I was like, wow, I like love anesthesiology, but I don't know if I can do it or I don't know if I'm capable. And I think there was a lot of this was before I started my clinical rotations, and there was a lot of faculty that I found and I opened up to and talked to them about, and they were really, really, really supportive of me. And I think that's something to this day I'm very grateful for, because it could have gone either way. You know, if I kind of reach out to someone and they were less supportive, maybe I wouldn't be going into anesthesia. So, but I think it's just, also good to, as reassurance that there are a lot of people out there that like support us for as many times as I've had maybe difficult experiences with Tourette's, whether that be in med school or prior, there's a lot of positives as well. In the OR itself, I think a lot of um, people with Tourette's and a lot of us in the audience are familiar with when you're really, really focused on something, you take less. And it's kind of ironic, but I take a lot less when I'm in the OR compared to when we're standing in morning rounds where we all discuss the patients and I'm just standing there listening. I take more there than I do when I'm like in surgery and, suturing or holding a retractor, assisting or whatever that may be, because I'm just so focused and engaged that it actually happens a lot less. So that is one good thing. I will say that a thing that I've run into is I feel a lot more tired at the end of the day because it can be physically demanding. And yeah, that can be tough because maybe my tics are a lot more worse kind of at night or when I'm not at the hospital. And I think that's where I've had to learn a lot about self-care, whether that be exercise, sleep, kind of diet, and the way you take care of yourself. I want to share story of a pediatric surgeon I worked with who was just so amazing, where one of the few people that I like opened up to pretty early on about Tourette's and I told him about it. And this was when I was still kind of on the fence about going into something procedural or not. And we just had such a great conversation about him saying, hey, like, I want to find a way to make the OR an accommodating place for you. And I don't want you to feel like you can't go into this if you want to. And he just made such a good environment for me. He gave me kind of tips and tricks and kind of gave me feedback like the next day, like, hey, Michael, like you did XYZ procedure really well, or whatever it may be. So he was just so great. So kind of with that, I will, in the interest of time, kind of move on, and we're happy to talk about more stuff related to this later. To Jeremy.
All right. Thank you for the transition. I know I was answering a few questions in chat there. Thank you to everyone that's put any questions forward. For my part, I kind of want to be able to tie in at least my personal experience between living with Tourette's, going into medicine, and then finding a way to be able to incorporate it into the pathway. I know that for me, and as Michael was saying, especially, there's many potential barriers that can happen with Tourette's. Whether it's physical, like this tic makes something more difficult, or whether it's our own belief in ourselves or someone else's belief in us. There's a lot of potential barriers that have to be recognized, understood, and oftentimes overcome. For me, I for many years, especially like, prior to college, I didn't know I wanted to be a physician. But I really liked working with my hands, and I have been doing glass blowing, which is a very, hands-on, tactile art form for many years now. It uses many tools. There's a lot of communication. It's generally done in teams. There were a lot of things that were quite had some parallels to the operating room, to working with others and recognizing, time-sensitive situations and being able to navigate those. But up until, shortly before going into medical school, I was not sure if something like surgery or something more procedural would be in the cards for me. I wasn't sure if, having Tourette's would be prohibitive. And I wanted to be able to explore, well, let's see if it is. So reasonably early in college, probably my second of 5 years. I took 5 years to do a bunch of extra things. I'm glad I did. But early on, I heard of a thoracic surgeon who has Tourette's. I saw him in the news for some things related to him speaking about having Tourette's and its influence and his experience with that, both in life and in the medical field. And then also I saw him in the news for just some amazing things he was doing in the field. And I was like, wow, like it's really cool. It was inspiring to me to know that there was someone else out there. And at this point, I'd never met anyone else with Tourette's. but that there was someone else out there that had, a similar enough experience to me and was able to go and pursue something where there were so many barriers that I saw in the way, but to still be able to go in there, succeed, and to me, it was really inspiring. I know I was like, uh, I was hesitant to reach out because I didn't want anything. I just wanted to be able to meet him and gain whatever experience I could, insight from his story. And I reached out shortly after getting accepted into medical school. I reached out. I said, "Hey, Dr. Sai." He's a thoracic surgeon. I was like, I literally just called his office because I was like, this seems like the most personal way to be able to contact them. And I was pretty much just like, "Hey, I'm going to medical school soon. I heard your story, super inspirational. Would love to meet you sometime." The long story short, I ended up going in, shadowing him. We really hit it off. And I was able to see him performing all these amazing procedures that, it'd be amazing whether someone has Tourette's or not. But I'd never even seen something so cool in medicine prior. And I ended up becoming pretty good friends with him and joining in on some of his research. And his level of Tourette's was quite similar, at least from my outside perspective, to myself. And that kind of reinforced my belief, like, okay, it's possible. Now it's more of a matter of, do I choose to confront these challenges? And is this field and are these interests, most in line with what I want out of my life, my goals, my interests, etc. So in college, during my last couple of years, I did some research related to Tourette's. But then now at that point, I was like having an opportunity to be able to work with a surgeon that had Tourette's on something that wasn't related to Tourette's. It was a very specific thoracic surgery paper, which is currently, we just submitted it to a journal. So hopefully that'll be published soon. But that kind of got me into a bit more of the, wow, surgery is amazing. Like, well, let me explore this to the fullest. Whenever I got to USC, I right off the bat, I reached out to a thoracic surgeon who I saw, his work was both interesting and also had some elements to some other outside interests I had. For me, whether I was going to actually go into something that directly is treating Tourette's or another field entirely, I wanted to feel like I was able to push forward the envelope and incorporate some degrees of my passion for helping people with Tourette's, with mental health, and making sure that their outcomes and everything is, as good. They're being treated well in comparison with the rest of the population. So right off the bat, I joined a research lab with a surgeon who was looking at disparities for mental health, how their surgical outcomes and all these other variables associated were different, and being able to recognize the disparities and hopefully, propose solutions to address them. So that's how I was able to kind of like tie in a bit more of my Tourette's interests, my personal experience, with being able to go into a surgical field and still be able to have that personal aspect, because I feel like Tourette's was something that was very important to me, something very personal to me, and I wanted to be able to continue to have my work help out that field in whatever way I could. I think the value of mentors, role models. I had many years where I didn't have a teacher that also had Tourette's. The first person I met with Tourette's was in my final year of college. There was another student who's now also at medical school. He joined the research lab I was working in, and I was mentoring him. And we noticed each other blinking, and we were like, "Oh, wow, you also have Tourette's." And being able to work together through that was great. But then so is seeing some people who are further along in the journey. So if that's someone else in here that is interested in medicine or health, hopefully being able to see that other people with Tourette's, I mean, mine is quite noticeable, but I am where I am, and it's possible. As far as reflecting on like how my experiences have influenced this work, it's something that's constantly influencing my work. I reached out the other day to another research lab that I saw was doing some work that looked like it might have a surgical relevance to psychiatric conditions. And I'm going to meet with a neurosurgeon tomorrow. I think that there's all sorts of ways that you're able to kind of take the initiative of finding, wow, this looks like this is in line with my goals. Let's explore that. Figuring out how involved you want to be with that. Everything else, there's a whole time management aspect to juggling life, particularly in medical school. Things get quite busy. But I think that always exploring your interests to the fullest, and I think that there's a lot of value in overcoming and facing particularly difficult tasks with Tourette's. I know that we want to be able to have a little bit of time for a group discussion. So if you guys want to move it on to the next slide, I'd love to be able to hear your guys' thoughts on how you ended up a bit more interested in the surgical field, because I know there were a lot of questions on that.
Yeah, I can. Oh yeah, go ahead.
Okay, I'll go ahead. So, why I like neurosurgery is because just like what you, Jeremy, and like Michael were saying too, like if you do something that you like and you really focus on it, it kind of allows you, it really decreases the tics that you have. It's really interesting. And the one thing that I really like is cleaning. And so my favorite thing is like finding a spot on like a wall that's a little dirty, and I'll scrub that for like, I don't know, 20 minutes until it becomes clean. But then I'll be happy and I realize like I did that. And so neurosurgery, I think, is similar. Like staring at a little tiny space for 12 hours without eating, sleeping, breathing, and just doing that. So that's why I want to do surgery.
Yeah, for me with anesthesia, what I love about it is that it's a great mix of a lot of different things where you get to work with your hands, but you also get to apply a lot of very actively, like kind of like physiology and thinking and monitoring. And I think my favorite part about it is I mean, everybody has this, but just really this sense of responsibility during surgery of like, you are literally keeping them alive. You're the one that's responsible for making sure they're breathing. You're always monitoring all their vitals, whether that be their blood pressure, their heart rate, or how they're breathing, based on like what's happening in the surgery. And you're ready to intervene, kind of at any moment. And I kind of love that kind of diversity in terms of what the job entails, where sometimes you're there kind of waiting for things to happen, hopefully don't want them to happen, but you're ready for every possible thing that could happen. And you're also doing a lot of things, whether that be inserting breathing tubes, starting lines like IVs, etc. And I think that's what's really fun because there's like a lot of tasks you can do. And I like doing things with my hands, but I also like kind of having a break. I used to work in chemistry and research, and I think this reminds me a lot of that job as well. I think one last thing that I love about anesthesia is um, the patient interactions. They always tell us in med school that to choose a specialty in which you really like the type of patient interactions. And I think a lot of the times, the stereotype of anesthesia is like, oh, you don't talk to your patients because you put them to sleep. And yes, they are asleep a lot of the times, but you have some pretty impactful moments that you're talking to the patients, in pre-op. Usually you're the one that's rolling them into the OR. You're usually the last person they see before they drift under. And you're usually the first person that they see when they wake up. And I think that is a role in which I really appreciate the interactions that I have with the patients, whether that be, you know, as a student, like a lot of the times we're able to go in and help with rolling the patient back. So sometimes that's like answering questions about the surgery. Other times that's asking them about their work or their hobbies or what songs they love and kind of helping them reduce anxiety prior to the surgery. And that is something that I have a lot of fun with. And I think that's what I'm interested in. Part of the reason why I'm interested in anesthesia. And I think we can move to questions.
Sounds good to me.
Same. Thank you guys so much. Another great presentation. For sure. We do have some questions here, and I know Jeremy was answering some of them as well. I do want to take a moment, though, if it's okay with you guys. I think, Michael, you were speaking on stigma related to procedural focuses in medicine and how that was for you. And I wanted to offer up, the opportunity to Jeremy and Kevin as well to speak to that, and Michael, of course, to expand, because I think that's a hurdle that many people maybe see to them getting involved in this career. So I think that's a question most folks may have. We could start there.
I'm happy to start off. I know that Kevin and I, we're both second year medical students. We're about to start our clinical rotations. So our, hands-on OR experience is not, we don't have as much as Michael, who's a year ahead of us. But I think that something that I've felt has been very conducive to my confidence in this is going into medicine. You don't need to have a specific specialty in mind, and you have plenty of time to make that final decision of, do I feel comfortable doing this? Is this something I want to do for the rest of my life, etc. All those big scale decisions. The way I kind of say it in a somewhat joking way is it's productive procrastination. You're still working towards becoming a physician, but you don't have to necessarily lock in of, hey, I'm going in, this is what I'm going to be doing, and then stick with that. So I think that what I would encourage anyone that's interested in healthcare, interested in medicine, potentially even interested in something procedural, is to just keep an open mind about it. Recognizing it might be more difficult, but if it's something you're interested in, continue to explore it. And then as you explore it more, you gain that confidence, or maybe you'll see, I'm not that into it. So whenever I get into my clinical rotations real soon, I know there will be some, challenging aspects, but I'm really looking forward to challenging myself with that.
I think on that point,
Go ahead.
what I think to myself when I do things is, as long as I can get it done, as long as I can finish the task efficiently and up to a good standard, then that's all that matters. So over the summer, I was doing some surgeries on rats, and they're really small. And every surgery on a rat is like a microsurgery, pretty much. And, I'm fortunate that I don't have a lot of big motor tics, but like vocal tics, when I clear my throat a lot, and other people are asking me like, are you okay? What's going on? And, at the end of it, even though it feels kind of stressful in the moment, at the end of it, everything, I'm able to do it well. And just being able to see that and realizing that it doesn't allow you to, not allow you to, it doesn't impede you in doing that. So in that, okay, my point is, as long as you're able to do it, then that's all that matters, and that you enjoy it.
Thank you so much. All right. Our next question is from the audience saying, when you complete a medical evaluation upon being hired at a hospital, do you feel it is necessary or helpful to disclose your Tourette syndrome? And how do you explain that it doesn't impact your work? And I know some of this may be tweaked a little bit based on where you guys are at, but that is our next question. Whoever wants to take it.
Yeah, I can kind of start. It's really hard, and I don't have a very good, satisfying answer to this question, other than it like really depends on the situation. But to be honest, it depends on where you're working, the culture of the place. It depends on you yourself as well. Jeremy and I were talking about this before this call tonight, and it really mostly depends on like you yourself. And that's something that I've talked a lot about with disclosure, is trying to shift the narrative in our head of it gets a little tricky in medicine when you're taking care of patients, but at the end of the day, broadly speaking, disclosure should be, you have to remember yourself in that. I think a lot of the times I put myself in situations where like, oh, I have to disclose so that others know blah 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 blah, so that others this, other that. And I think that's great, but it's really important that you don't lose yourself in that. Remember, hey, like, do I want to disclose? Is this something that I want to do? And a lot of that is really going to depend on you, and how you see kind of your Tourette's and your tics kind of playing out in your work. I've been pretty fortunate in that in any of the interactions that I've been having with kind of patients, I very rarely bring it up right away. And it hasn't impacted anything at all. And no team has kind of mentioned it as being an issue, so I haven't brought it up. Um, I can't, that's not always the case for everybody, but that's just kind of the situation that it's been for myself. But there have definitely been times where I've had a few concerns, like from my end of like, I think I might want to say something, and I have kind of like proactively. But it's a very non-satisfying answer, but essentially it depends and it's situational. And I think that's what makes this hard. I think that's a challenge of having Tourette's and being a medical student is that, I have Kevin and Jeremy here, but at my med school, I'm the only one with Tourette's that I know of. There aren't really people to talk about this with. There aren't really people to relate to with. Other classmates are not necessarily dealing with this in this exact way. And that's just one of the challenges that we deal with.
Anybody else like to add before I go to the next question?
I think that I agree with everything Michael said. For the most part, I don't disclose it. If I recognize if it's creating a situation where I think that it might be too distracting to the conversation, then I might be like, oh, if I'm blinking, it's just Tourette's. Don't worry about it. Obviously, you say it in a context appropriate way. But for the most part, I almost never do whenever I'm interacting with patients. It's something that I'm going to have to, decide and navigate a little bit more once I get into the clinical aspect. Is if I have, let's say, an attending physician, that's the main doctor there that you're working with. If they're going to be my preceptor or grading me over a while of time, then I might say, hey, just so you know, I have Tourette's. You don't have to treat me differently or anything, just letting you know so there's no miscommunications. But I think it is very circumstantial, and hopefully I'll have more insight on that as I navigate that soon.
So, quite a few questions in the chat centered around the theme of self-care, and some of it is asking about relationships with friends, family, advocating for yourself, just general self-care, habits. I know that all of you have kind of touched upon this during the presentation today, but is there anything you'd like to add for the audience about what works for you with self-care?
I think something that Kevin said earlier definitely resonated with me. I think that consistent sleep schedules. I try my best. I'm not always great at it, but I think that that's one of those things where if you sleep well, tics are generally going to be less severe, less frequent. Another thing that I've done that I'm not sure if it's Tourette specific, but I do tons of daily checklists. So if I'm right as I start my day, I pull up I'm surrounded by many large sticky note pads where I have my check boxes of everything I want to do that day, and it makes me feel a little bit less scattered. That's just another way that I like to try and reduce my stress because I have a lot of things on my plate, and having that sense of organization has been pretty helpful for me.
One thing of self-care that I learned over the past couple of months, maybe even year, is that in medical school, we're always studying so much and there's always more to study. So whenever I'm out doing something that's not studying, I always feel bad a little bit, thinking that I could be using this time to study. But it really took a while, but self-care is honestly probably more important than studying, because if you're not physically healthy or mentally healthy, you can't really learn very well. I realize that. And so it's really took taking a change of mindset. But now when I sit down and watch football or go out for a walk, I just change my perspective and just tell myself that it's just another task that I need to do. It's not about I'm not using this time to study when I could. This is what I need to do right now to stay on track. and it's really helped.
Yeah, briefly, this is not a Tourette's related kind of strategy, but I think what I've found, started doing this in medical school, actually, I wish I started doing this earlier, is a rule for myself is that the last thing that I do before going to bed, like cannot be work. Like when I was in, prior to med school, it was always, kind of cramming in whatever studying or whatever it is that I'm doing right up until I'm ready to go to sleep, and then I can bang and go to bed. And honestly, it was really bad because you'd go to bed with the stress and wake up with the stress. And that's kind of a rule I've set for myself for now, where I make sure that I have enough time, no matter what, to always make sure that the last thing I do is not working. So whether that means watching some TV, doing whatever it is, I always make sure that I don't just like study and then sleep. Yeah.
I think just to add on to what you guys both said, I think that having that time that you are doing self-care, but having it be dedicated self-care and like fully removing yourself from the studies, like I feel like has been helpful for me. I try and have it be, whenever I'm relaxing, I'm actually relaxing, and not have too much of a, half relax, half stressed about studying, and kind of just pull the plug whenever it's time.
I think we have time for one last question, and I see a couple of questions again related to a general theme here, and I think it's really having the unique opportunity to be medical students and also have Tourette syndrome. Any thoughts or feedback on where you see maybe different practices, research, and outcomes heading for those with Tourette syndrome and tic disorders?
I'm happy to give this a brief start. I know that anything I say is not medical advice, the whole spiel. I I know that there's so many different pharmacotherapies that have existed and are currently being developed. As we learn more about the mechanisms behind Tourette's, they're coming out with more ways to be able to address it. Some of those are pharmaceutical, some of those are not. I know that CBT, other behavioral therapy, talk therapy. There's all sorts of different ways where without pharmaceutical intervention, you're able to reshape your thought process on things. That's able to be very effective. As far as other promising pharmaceutical outlook for the future, I know that there's a lot of neuromodulation experiments and trials and new devices that are coming out. And I'm optimistic that there will be more, continually more effective symptom addressing through those, through the pharmaceutical aspect, through the therapy aspect, through biotechnology. I can't speak on that aspect as an expert, but I'm optimistic as a medical student that has Tourette's.
The brain is a black box, and there's infinite things to discover about it. And I think we're going to figure things out soon. And that's why neurosurgery is cool.
Well, thank you guys so much. Another amazing event to this series as a whole. We appreciate you greatly. If you don't mind advancing to the next slide, we'll put the QR code up. Please take the time to complete the post survey for this program. It is in part made possible by your feedback, so we greatly appreciate it. And you also can see the link on the side in the chat as well, if that's easier for you. We hope to see you for the third installment of this series, which is going to be held on December 2nd at 8 p.m. Eastern Standard Time, like tonight. And we appreciate our presenters and all of you for coming today. We hope to see you again soon. Thank you.
Thank you, everyone.
Thanks, everyone.
Thank you.